When we use the term low vision, sometimes it's confusing for people because what does that mean exactly? Low vision really encompasses a number of findings and a number of symptoms for the patient. So if a patient has any conditions such as macular degeneration, glaucoma, diabetic retinopathy, any other disease process, then it can lead to the patient having low vision. One of the main things we're going to see in a patient with low vision is reduced visual acuity. So this means that typically we want to correct a patient to 20/20 on the eye chart. Once a patient has physical damage to the eye from the disease process, they're no longer correctable to 20/20. So as time goes on, particularly if it's a progressive condition, then we may see the visual acuity reduced to 20/40, and then in a few years it may be reduced to 20/70, and so on. So visual acuity is the main thing we associate with low vision. The effects of that, of course, are going to be difficulty in doing things like driving, difficulty in watching television, seeing detail on faces, recognizing people when you're in places. And then that will also have difficulty with things up close, so reading, using a computer, any detailed near vision as well. Another big thing that we see as a symptom of low vision is going to be what's called reduced contrast sensitivity. So when that decreases, that means that if everything's like really nice dark black on a white background, it's going to be easier for the patient to see, but as it starts to fade out, it becomes more difficult. So if somebody's trying to read something on a paper and it's black ink on a white background, they may be able to see it in a certain size, but when they pick up the newspaper, they may no longer be able to read that because the contrast is poor. Another common finding is glare sensitivity. So this could be where they're sensitive to lighting indoors or outdoors or both. And so we may find that these patients tend to do things like wear a hat or sunglasses frequently. It can also be a disability glare to where it washes things out and they're no longer able to see. The best example to compare that to is if you've ever been in a really dim setting, like say at a movie theater, and you've been in the dark for a long time and then you emerge into the bright sunlight and it's blinding for a moment and you're unable to see. That's what somebody with low vision can experience on a regular basis.